Hi, let me give you this suggestion because I have seen many patients in our family. When the family is very big, of course, there are so many people, so at least one is, I mean, at least a few having issues. And I'm just trying to tell you about a few things before you are getting into any treatment, any surgery, any medical procedure, even before blood donation, whether you are receiving it or donating it. This is out of my experience. Do not consider that this is the final statement. I'm not a certified physician. I'm giving you the information out of my experience, from our family, out of my own experience. At first, you are getting into the hospital for some issue. The questions will be asked. It's depending on the condition, the temperature, the pulse rate, and the BP. If at all, according to the age, even the ECG will be taken. So the normal procedure will be like this. It's all about what you are trying to say. About your problem. And the general questions before the diagnosis will be like this. Do you have an allergy that is related to the food or related to the medicines? Then, did you undergo any surgery in the recent period, in the past 6 months, 3 months? Was there any surgery performed on your body? Did you have jaundice related to life-threatening diseases? They ask this fundamental question. Jaundice related or any life-threatening condition. And if it is related to dental, please try to understand one thing. They check everything and they will give the opinion. If you are not sure about what it is, you can check in Google or you can check with any other doctor in other hospitals. If it's not related to the life-threatening situation, you can wait. If you are not sure about the procedure, please, if it is not a life-threatening situation, if it is not related to, it has to be done within a week or two, it's better, get the second opinion. If the patient is unconscious, if there is anything, if the patient is not able to say anything, and then it will be discussed with the family. And if the patient is not having an idea about it, if the person is not able to understand the procedure, then it will be discussed with the person in the family related to the procedure. Everything will be discussed. The test, the diagnosis, the test related to lab, related to X-ray, scan, everything will be discussed. It will be written. This is what I am suggesting you. You take the test. At first, you will be confused. You are getting into the hospital for some treatment. If they are telling the procedure, if you are not able to understand it, if it is not life-threatening situation, if you are conscious, you are able to walk, then you must understand one thing, that you can just wait. It's out of my experience. Don't take it seriously. It's up to you. Because you must check with another doctor, get a second opinion. Or check with the internet. But don't take decision based on the internet. You get the opinion, idea about it. What is that? Because in Manipal they drill the holes. I never heard that sort of thing. They said that the root canal will be done. And there were many in my house, they have experienced the same, but they did not undergo this sort of drilling procedure and all. They drilled 4 holes at a time. One by one they could have done it. Okay, they talked about the procedure. I couldn't get it. I was understanding the procedure according to my knowledge. But I would have checked with other doctor, dentist before getting into the medical procedure. I didn't do that. That's why I'm telling you, you cannot simply blame the doctors or the hospital if they are not sure about, if you are not sure about what is that, it's better wait and check with other doctors, other hospitals, then decide that. If it is not related to life-threatening situation. If you are unconscious, obviously you cannot take any decision, but your family is responsible to take decision. And for your information, everything will be diagnosed before they are prescribing the medicines. Everything will be discussed with the patient or with the family. If the patient is conscious, everything will be checked with the patient regarding the allergy, regarding the contagious diseases, infections. Everything will be checked with the patient before they prescribe anything. And everything will be recorded. Everything will be recorded in the case sheets. No one can hide anything. What they did, what they prescribed, how the diagnosis was taken, the lab test, scans, x-ray, everything will be noted. Where, how, what, the time, the duration will be there. Everything will be given. No one can deny, no one can say that, only I can understand, the other doctors cannot understand. There is no such procedure in the world. Please make a note. If the doctor is checking something, he is going to mention it in the case sheets. Everything will be recorded. No one can escape from what they did. And there is no such thing in the world, like no other doctor can understand the procedures, whatever performed in one particular hospital with one particular patient. There is no such thing as that way they are stating. Got it? Because 20 years ago they were able to record the angiogram as well as the angioplasty. They gave the CDs, how they performed the operation. Even my mother said that. She was conscious while they were performing the operation. She was able to see that on the screen. She said that, she was simply humming some song. She was not having any fear. Because I was asking something, I was waiting in the lounge. the patient's attenders. Uh, no, it's all about in Apollo Hospital there is a separate lounge for the attenders. I mean, if they are performing the operations, they have a separate lounge for the attenders. It is not the common place. So if at all, if there is anything, no, they will. That is the AC lounge with the pushback seats. Why should I have to mention it? Because you just see the advancement in the medical technology, medical science, and you just the hospitals are having the high class in a 5-star hotel like appearance, as well as the treatment is also like that only. But it's all about your interest. Just because they are saying, you don't have to follow that. You can get the second opinion, because they are going to talk about everything. After the diagnosis, they will check everything, and the normal test will be there. Before the angiogram, there are so many tests. ECG will be taken, treadmill test will be there, and all of the tests related to the blood sugar, BP, everything will be taken before they plan for angiogram. After that, the whole thing where the block is there, how many blocks are there, how small, how big it is. You know about the veins and how thin it is. So if you are getting into the research, then only you will understand how big it is, how small it is. Otherwise, you can simply node, or you can simply get the information. But there are things, if they are giving the diagram, after that the angiogram, it is the diagram where the blocks are there. That diagram will be given where the blocks are there, how many blocks are there, which one should be removed, because it is according to the size. See, the open heart surgery will be done, if the angioplasty is not possible, then only they will go for that procedure. So everything can be recorded, and not only this angiogram, angioplasty, all the operations can be recorded. Digitally it can be recorded, and also everything can be written. Everyone will write, the case summary will be given. When you are stepping out of the hospital, everything will be noted from day one. From the day one, everything will be noted. So you must be aware of one thing, that whether it is the life-threatening situation or not, are you conscious or not, can you wait or not, and also your family should agree with those things. You cannot simply take the decision because you are a patient, and also your family is responsible for the decisions as well. If you are going alone, if it is not the life threatening situation, say you are not going to die, it can be done after 2 months, after 3 months, after 6 months. Then you can wait. But if you are not able to, if you are not having any idea about what it is, if you think that you can wait, you can simply ask the same question. Can I wait? Can I do it tomorrow? Can I check with my family? You just wait for it. Don't take decision on impulse. No one is forcing you to undergo that sort of procedure. Please make a note. It's up to your decision. But you are not the physician. At the same time, if it is related to any situation that can be dealt after a few days, it's better to take the second opinion. We have mobile phones, you just call, check with your family members, or then and there open the Google, read the procedure. Because if if it is in Latin and Greek language, you won't get it. You will not understand it. You cannot bear the pain if you are not able to, if the fever is high or any other life-threatening situation, you cannot take the decision. But of course, you are not going to die within 2 minutes. If you are very unconscious, you are not going to take the decision. If you are conscious, if you are able to wait for 1 or 2 days, just wait. Check with someone else. Check with your family at first. And it's all about you. You are going to bear the pain. You are going to face the consequences. You are the one going to suffer in future. So you must understand all the things related to any medical procedure, and no doctor can say that I'm the only person can understand the procedure, what I did. That's the myth. If the case sheet is provided, case summary is provided, it can be understood by any doctor in the world. Please try to understand. Many things are there in the medical field. It is very, it's really having the advanced technology. And also nowadays, it's all very transparent. That's why I'm giving you the example. 20 years ago, they were able to record the whole procedures. Digital record is there. Digitally, they could record the operation, the angiogram as well as the angioplasty. Everything can be diagnosed before and after the treatment. And all the summary related to the procedures, whatever related to the diagnosis, treatment, surgery, post-care, they will check everything. They just don't send the patient within a day or two. They will monitor this condition of the patient for at least 2 to 3 days. And then The final statement will be given by the physician by checking the present condition at the pulse rate, at the BP, the temperature, the blood sugar. Everything will be diagnosed, even sometimes according to the age. The ECG also will be taken. And when they confirm the condition of the patient, everything is normal, then only they will, discharge. They will sign for the discharge. So it is your responsibility because it is your body. If you are conscious, if you are able to wait, bear the pain, it's up to you. I'm just giving you the opinion out of my experience because my uncles, my mother, my aunt, there were so many in our family, and one of my uncle, he was having some issue. He was in Ramachandra Hospital in Chennai. I was there because they are from Neyveli. At that time, no one was there. So, for 2 to 3 days, I was there with my aunt. And everything was discussed with me. Now, I was there to take the decision. Just imagine. I was the person taking the decision whether I was the only person over there to take one decision about the discharge. If I say yes, he will be discharged. If I say no, they will do the procedures, whatever they could. So you are having the responsibility of saving one's life. Your decision. Of course, you are not going to take the ownership just because you took the decision. Because you are not a physician. You can only decide what you could do. And also, in your family, there are so many. You can simply convey the message. That's it. And everyone should discuss and take the decision. See, whenever the doctor is discussing the things, it's really disheartening at first. When you hear that this is the condition of your mother, this is the condition of your uncle, this is the condition of your son. My son Juno was having the issue, right? I felt, that was the worst situation in my life. It's like, I'm the person receiving it. It is a great shock. It's not easy to receive the message from the doctors. And also, whether you are the patient or not, it's too tough. Because you are the only person going to pass the message to others. But nowadays, the things are changed. Everything is transparent. Everything is transparent. No one can hide anything. Whatever treatment, the diagnosis, treatment, post-care, everything can be written, recorded, digitally, manually, orally, by oral discussion. Please understand that when you decide to donate your blood, they are going to ask 20 questions. It's all about saving the life, and also they are caring about you too. If you are a woman, they will check whether you are undergoing the menses. Everything you have to say. When was the last time? You need to mention about the dates, the menses, the duration, because in a few, when you talk about the menses, the women, when you talk about a few, are many. I don't know about it, the exact count and all, but usually 3 to 5 days, and the bleeding will be normal, or sometimes it's all depending on the marital status or physical condition. The bleeding will be high or low. You must say that. You must express everything what you've been through. Any surgery, allergy, infection, jaundice, HIV, HPV, everything should be disclosed before you donate your blood. Before they receive the blood, they collect the information. Alright then, if there is anything else related to the medical procedure, I'll let you know about it. I suffered from the dental related issues for 1 year because I simply noted for one procedure without checking with my husband, without checking the internet, because I had the knowledge, because already people were there in my house, they have experienced the same. But I never heard this sort of procedure. They drilled 4 at once. So you just take the note and try to understand one point, that if it is not the life-threatening situation, if you are conscious, if you are able to bear the pain, just wait for few hours at least. Check with your family, check with the internet, but internet is not going to give you the right suggestion, but you can get the idea about what it is. That's it. You check with the other physician or doctor in other hospitals. Then you decide. Only if you are not under the circumstances related to the life-threatening disease, disorder, or situation. Thank you very much for your time. I'll talk about it later. Till then, take care. Have a good day.